Hello, my name is Johan, and I'm going to be your occupational therapy student voiceover for today. Here we have a client. Her name is Kim. She is a 68-year-old woman. She has never been married, and she is Caucasian. Her expected hospital stay is going to be 2 weeks, as she currently underwent a coronary artery bypass graft 2 weeks prior, which means that she had 3 blocked coronary arteries. Her secondary diagnoses are congestive heart failure, diabetes, hypothyroidism, and schizophrenia. Her current recovery is unremarkable on her incision site. Her current environment, she works part-time as a clerk in a convenience store, moving boxes, stocking shelves, and managing the cash register. She has one sibling, a sister, that unfortunately lives too far and is unable to travel. She has 2 pets, Cleo, a parrot, and Casey, a dog, which she considers them part of the family and loves to take Casey out for walks with Cleo on her shoulder. She constantly worries about her animals while in the transition and care unit. She has very few friends and has a hard time making friends because she is socially uncomfortable. So she has a very limited support system. Her plans are to return home to her pets and eventually return to work, as well as to the hospital day program that she used to go 2 days a week. Some of the precautions for this surgery are not to reach both arms overhead, don't reach both arms out to the side, don't reach behind your back, no lifting more than 5 to 8 pounds, not pushing with your arms. For example, do not push yourself from a chair, as well as don't pull with your arms, as in don't pull in, open a heavy door, and not driving, not even for short distances until cleared by the physician. Some of the contraindications for the surgery are refractory congestive heart failure, frequent tachycardia, moderate to severe vascular disease, conditions that will increase the risk of thoraconectomy significantly, previous internal mammary ligation, or previous surgery within the pericardium. PTs and OTs can assist Kim with completing some of the following activities as she heals. Some of these activities are standing up from a seated position, climbing stairs without pulling on the rails, turning over in bed, using a cane or walker, which she is already doing, and performing everyday activities such as dressing, brushing her teeth, brushing her hair, etc. Her main deficit is fatigue and poor endurance for all functional activities. Kim's short-term goal will be to improve her sitting endurance to perform grooming, wash-up activities with standby assist within 2 weeks. She is currently ambulating with a rolling walker due to her lower extremity weakness. She has a pain of 6 out of 10, and her goal is to return home to her pets. The rationale for this is to get her to participate in more functional activities. Kim needs to get stronger and build stamina and endurance to allow her to sit on bed for meals, transfer from bed to chair, to a recliner, to strengthen her core and breathing, and gradually increase time using the rolling walker to perform functional activities of daily living, or as washing up, brushing her teeth, grooming, and dressing when cleared by the physician. It is important to educate her on continuing to take her prescribed medication post-surgery and for her conditions such as schizophrenia, in order for her to continue progress and to return to her pets and desired goals. Well, that's pretty much it. Thank you very much for listening, and I hope you enjoyed the video. Thank you. Hi, how are you, Kim? My name is Johan. I'm going to be your occupational therapy student for today. How are you feeling today?
I'm in pain and I'm tired.
Okay. Well, here you have, you just had some surgery. Okay, so I'm here. I just wanted to see how you were feeling, okay, and also wanted to see how you're moving. All right. So let's see if we could try to stand you up real quick, okay? I'm gonna bring this up here. All right, and I'm gonna give you assistance, okay? So when you stand up, I want you to go ahead and push from the bed, okay? All right, on 3, all right? 1, 2, 3. Can you stand up straight or no? It's too painful.
Too painful.
All right, go ahead and sit down again. Okay, so how did that feel?
Painful and I'm really tired.
Okay.
I'm out of breath.
You out of breath? All right, where's the pain that you feel the most?
Right in my chest.
How much is that about now?
About a 6.
Okay. All right, so what I think I'm gonna do, I know you just had your surgery and it's still pretty painful right now, okay? So I'm gonna kind of instruct you on some of the things that you wanna do, okay? The first thing is, can you sit up a little bit straight? Does that help a little bit? All right. So when you're sitting up straight, it kind of fixes your posture a little bit, okay? So I want you to still keep over your precautions, but I also want you to get some of that posture back so that you're able to breathe a little bit better. Also, are you able to breathe in and breathe out? All right, so that's another thing that you could do. I want you to breathe in, breathe out. How did that feel? So I still want you to go a little bit deeper. Breathe out. Let's do it one more time. Breathe out. All right, good. So these are some of the techniques that I want you to continue to do, especially when you're feeling fatigued, you're feeling tired, as well as to continue to take your medications that the doctor prescribed you. Pain medications, yeah. So your pain medication, I want you to continue to have correct posture and continue to do some of the breathing techniques so that when you're feeling fatigued, it's going to be able to rehabilitate you a little bit faster. So that way you're not super tired. Okay. I'm glad to see you today. So I will be checking on you again, okay? And we're gonna see how everything progresses, especially with your incision and your pain levels, okay? So pain medication, I want you to continue to take the medication, your posture, okay? And I know since you're feeling fatigued, do some of those breathing exercises throughout the day. That way you don't feel as tired when you complete your daily test. That way you're able to do the stuff that you want to do. Okay? All right, it was great to see you, okay?
Thank you very much.
You're welcome.